Okay, this video is filmed 1 year and 1 month after the patient have had a FUE hair transplant done by me. We did around 3,000 grafts. We put in the frontal area, the mid scalp, and the vertex area. And the result is amazing. It's very natural. And I want the audience to know that FUE works very well. The younger surgeon tend to work better because they depend a lot on the eye and hand coordination. So the older guy, the hand shakes too much. The eye, it's not there. So it's hard for them to do. Let me give the clue to who are the good FUE hair transplant surgeon. Are the one who invent their own instrument and the one that use their own manual instrument. Pretty rarely they need to buy an instrument. The people cannot do FUE end up buying a NeoGraft machine or any other machine. And that machine, one is it vibrate and it kill the roots. Number two, the suction will dry out the graft and it will lead to poor growth and bad. And number three, I heard the size are large, but now they can change the size, whatever. But number four, the other very and most important is that most of the clinic hire a technician to extract the hair graft. That is not hair transplant. With me, FUE, I'm the one who pulling the hair graft. Is that right, David?
That's right.
I'm the one who spent 4 or 6 hours. Because you don't want to have a technician pull the hair graft because the result going to be bad, and and it lead to poor growth. And that's why some clinic was trying to cut corner, trying to charge FUE cheaper, and then because they have the technician doing it instead of the physician doing it. And some places the technician does everything, pull the hair graft, design your hair, pull and make hole in your head and push and pull the hair in. And so that's not even a physician doing any part. And then that's going to leave you poor result. And when you hair transplant and under anesthesia and those stuff, you want a cosmetic surgeon, a surgeon who's board certified, who have all this technology and all this stuff doing it, and a physician, an FUE hair transplant surgeon who can show it. And another thing is, some doctors talk about doing FUE but not actually show it on the video and all the stuff. For me, I love FUE and I perform it quite often. You can see I do half of my surgery are FUE and half of my strip. But strip, there are places for it, like patient cannot afford it, they have to go strip. Or the hair loss is so advanced they need like 6,000-7,000 grafts, then you go with strip. But before we go further, I want to show you the audience what David looked like before and after. And this is him. You close up, you can see his hair loss, and he's thinning in the back too. And this is his frontal, right side view, left side view. Left view is on top, and this is David. And we're gonna have zoom in closely. I want the audience to see how dense his hair is, and we comb through it. And FUE can be done and it looks very, very natural and dense. Remember, when FUE, do not go too cheap because then you know if something's wrong. That means too good to be true, or their quality is no good, or they're trying to practice on you, or the hair technician is pulling out your hair, not the surgeon. Before you go further, I want you to go to my website at www.mhtaclinic.com, 1-866-999-6482. Getting back to this patient. Okay, go ahead. I'm going to turn the stage over to David Murray, and he's going to explain his experience from how hair loss affected him, his research, why he chose me, and his experience on the day of surgery, his recovery period, and until now. And no holding back. The uncut version. So go ahead, David.
Sure. So my honest experience, I was 27 when I decided I wanted to do something about my hair loss. Friends were making comments about it. I would look at myself in the mirror and I would feel unattractive. I would go clubbing a lot. I would have fun with my friends a lot, and I wasn't getting noticed, and I just felt really bad about myself. And I decided that I wanted to make a change. I decided that I wanted to invest in myself. And so I started doing some research online. So, I'm a kind of a tech savvy guy, so I went to YouTube, I went to Google, etc. Did a bunch of reviews and saw like, you know, other people's experience and opinions of the various professionals out there. And you know, I saw Dr. Diep's actually a YouTube video you know, a video of someone that Dr. Diep had worked with, and I was really impressed by the results. So I did a little bit more research, and I learned that there's basically, you know, there's a few things you can do. You can go to Bosley, or you can go to, you know, one of those places that's basically, it's like you come in the door, you come out the door. I actually talked to some friends that experienced those things. It's really not a good experience. It's definitely not personal. It's definitely cheaper, and of course, you know, I mean, you get what you pay for. And so I wanted to have a good experience. So you know, I did a little bit more research. I saw that I could do FUT, or I could have a permanent scar on the back, or I could do FUE, where, you know, individual hairs are basically taken out and put on, and there's no real visible scarring. And I decided that although that route was more expensive, it was going to be a higher quality result, because I wasn't going to have that kind of visible scarring that I really was afraid of. So, you know, I took a stab at it, met with Dr. Diep, was very happy with what I'd seen just from the before and afters that I had already looked at, and also, you know, very friendly guy, very honest guy, definitely willing to, you know, be honest about everything. I mean, it's true that the photos that he took were all using flash, you know, both before and after, so he's not playing games. So, you know, we set it up, and then a little bit later, you know, I don't remember if maybe a few weeks later or so, you know, we set up, we went to surgery, and I got my transplant done, and it was a really long process. It was basically several hours in a chair, and that piece was a challenge for me, because it was I mean, there was a TV, which was nice, and I was comfortable, you know, a little bit of drugs beforehand to kind of help ease it, but I was fully awake the whole time. And actually, to be honest, it was, you know, I had a lot of conversation with the folks that were helping out, and it was, you know, we made jokes and stuff, and it really wasn't that bad of an experience. But it was a long experience.
Maybe I should, with drugs, I should give you some music. Huh?
Yeah.
And you feel like you're a nightclub.
Yeah. No, I mean, it was good. It was good. So, you know, it was a long process, but you know, at the end, once it was over, I mean, that was it, and then it was just healing. So for me personally, I had actually a relatively rare reaction, because my skin is histamine positive, we call it. You know, only 5% of people that come in have this, and I particularly have it because I'm, you know, pale skinned Caucasian guy. It doesn't mean all pale skinned Caucasian guys get it. In fact, only a small subset. You know, again, it's like in the 5% range, but I happen to be one of the 5%. So you can think of me as potentially like one of the worst case scenarios in terms of that experience. And at first, it was a little bit, you know, concerning seeing the redness, you know, as I had to kind of go through my day and deal with that. But, you know, over the course of months, it faded. And once it was totally gone, it was like night and day. I mean, once my hair had started really growing in, people started to notice. And I had more confidence. And I went out more. I had fun with my friends more. I got noticed by people more. It was really night and day. And when I look back now, a year afterwards, and I compare to the before and afters, I didn't even remember like how bad it was until I saw those pictures, and I went, oh my gosh, like huge difference. So, you know, it's been a wonderful experience. I know that, you know, although the transplanted hair is going to be there, my other natural hair will continue to fall out as I age, just because that's, you know, it's what God gifted me with. So I'm definitely willing and open to doing it again, you know, well down the line if I've lost more hair. I think it's a great investment. In terms of like deciding to invest in, you know, let's say a really nice car, so that maybe the girls or the guys or whoever will come after you, versus investing in yourself, in your hair, in your face, in your body, you're going to get a better return on your investment if you invest in yourself. So I would always say it's worth the money. Spend the extra money to do the better, higher quality route. Don't settle for like a Bosley. Don't settle for people that use these motors, or people that don't know how to control themselves as they're trying to do this. Like, settle for somebody who knows what he's doing, who does it himself, and who follows up with you afterwards, and who takes care of his patients. So, you know, that's Dr. Diep. So, yeah, I'd recommend him for sure.
Not the technician, right? You don't want a technician to pull your hair out.
Yeah.
Okay, well, thank you very much.